Well, good evening, Carrie. Thank you so much for all of your help tonight, and good evening to each and every one of you. I want to say welcome and thank you all for joining our telephone town hall on California's coronavirus response. We're currently 800 strong on the line. Tonight, we're going to have a very special focus on Trinity, Humboldt, and Del Norte counties. Again, my name is Mike McGuire, and I'm honored to be able to work with you as senator here on the North Coast. The most important part of this evening is going to be hearing from you. We're going to spend as much time possible answering your questions and comments in real time. If you'd like to be able to send in a question or a comment, please do so now. Senator.mcguire@senate.ca.gov. That's senator.mcguire@senate.ca.gov. We look forward to hearing from you. And I got to say, we have an outstanding panel joining us tonight. Before we get into the town hall, I would like to be able to make a few brief opening remarks. First, let's start with some good news. Early, decisive action taken by North Coast counties, boards of supervisors, and public health officials have literally saved thousands of lives throughout our region with the shelter-at-home orders. That said, this has not been easy, and the best thing for public health has been the worst for our local economy. We've faced many challenges, which is why we needed to advance these shelter-at-home orders. Number one, a vaccine is still at least a year away. Number two, there isn't and there will not be a robust federal testing program. And three, the antibody tests that would have provided us with the data we need to make sound decisions simply isn't ready for prime time. The stay-at-home orders have been our only tool in the belt that we could utilize. Now, that's starting to change, and I'd like to be able to start this evening's town hall talking about reopening our economy. The state is focused. We are focused on establishing the process to gradually reopen lower-risk workplaces and getting folks back to work. There will need to be modifications. Here's what this could mean. Giving mom-and-pop retail businesses, the heart of our local economies, the ability to be able to provide curbside pickup, or allow them to be able to limit the number of customers that go into their store, or allowing manufacturing firms the ability to reopen while they keep their workers safe. Several Northern California counties this week have begun to relax their stay-at-home orders by opening up local parks and specific public spaces. You can expect statewide modifications to be done in stages over the next few weeks, not months, as long as we continue to keep virus numbers low. I want to be clear, though. When we reopen, it won't be business as usual. Small businesses throughout the North Coast should be preparing to reopen by setting up physical distancing standards. They should have masks available for their employees, hand sanitizer, and other physical barriers in the business to be able to keep both employees as well as customers safe. And candidly, large events with large crowds will not take place at least through the summer months. I know this has been an incredibly difficult time. There are so many that are hurting in our communities, and we still have challenges ahead, but we are starting to see that light at the end of the tunnel. I now would like to be able to turn to testing. It's one of the biggest issues that we hear about. So starting this week, some additional good news. The state is expanding state-sponsored testing in communities with a focus on rural centers. One of the first state-sponsored sites is now open in Humboldt County. More sites in other rural counties will be introduced over the next few weeks, and the state is committed to continue our expansion of testing. It's absolutely critical to expand testing to ensure the success of the reopening of our economy. Finally, what's happening tonight, what's happened over the last several weeks would have been unimaginable just a few short months ago. Please know that we are here for you now and in the months and years to come. I would now like to transition and go over the flow for this evening to introduce our speakers. First and foremost, we're going to hear from one of the best infectious disease doctors in California. That's Dr. Brewer from UCLA Medicine. He's going to give us an overview of what we know and where we're going in the state of California when it comes to the coronavirus. He's also going to be focusing on antibody testing as well as concerns about opening up our economy too soon. We're then going to turn it over to those who are on the front lines combating the coronavirus, and those are the public health officers. First and foremost, we're going to hear from the hardworking Dr. Frankovich from Humboldt County. Then we're going to hear from the tireless public health officer in Del Norte County, that's Dr. Raywald. And then we're going to hear from Trinity County's Director of Public Health Nursing, Marcy Kutzel, as well as the County Administrator in Trinity County, Richard Coons. Each of them are going to be focusing on the confirmed number of cases in the counties. They're going to give us a testing update, and they're also going to provide what opening the community will look like and what that potential timeline may be. Finally, we're going to spend the bulk of our time this evening answering your questions and your comments. And again, you can hit us up now with your questions and comments at senator.mcguire@senate.ca.gov. Without further ado, we now would like to be able to turn it over to Dr. Brewer from UCLA Medicine to be able to give us an overview of the coronavirus in the state of California. Good evening, Dr. Brewer. The floor is yours.
Good evening, Senator McGuire, and thank you very much for having me. And again, I just want to add my thank you to everyone in Northern California for your tremendous help in trying to help us contain the COVID-19 pandemic. So where do we stand? It's hard to believe that before the end of December of last year, no one had ever heard of this virus. And yet now we're looking at a situation where globally we've had more than 3 million cases and more than 200,000 people have died for a case fatality rate of about 7% across the world. Unfortunately, the situation in the United States hasn't been much better. As you probably know, we have now passed more than 1 million cases in the United States, and we've had almost 60,000 deaths, so just under a 6% mortality rate. You've probably heard that African Americans have been harder hit, and that's definitely true. So African Americans make up about 13% of the population, yet they account for about 30% of the cases that have happened across the country. Fortunately, in California, the situation has not been quite so bad. So African Americans in California account for about 6% of the population and about 7% of the cases, but overrepresented in deaths, about 10% of the deaths. Here in California, we've had just over 45,000 cases, and we've had 1,800 deaths, a mortality rate of about 4%. So we're doing a little better than the country as a whole. And where your tremendous work and staying at home has come in place is if you look at rates adjusted for population. Remember, California is about 34 million people. And we have about 114 cases for every 100,000 persons in California. To put that in perspective, that's 10 times lower than the case rates in New York and New Jersey. So the sacrifices that everyone in California has been making are paying off. We are seeing that in both our case rates and in our hospitalizations. So if you look at hospitalizations, they've been level at about 5,000 people in the hospital at any given time in California since about the middle of April. So I think this is starting to work for us. I want to briefly turn to antibody testing. So there are two ways we can test for infections. One is to look for the actual virus, and that's a swab test that the public health people stick up your nose. And what we do there is we look for a piece of the virus called the genome, part of the RNA of the virus, and that's the test we use to diagnose infection. So if a patient came to see me at the hospital and I want to know if they had COVID-19, that test is the test I would use. Right now, the antibody tests, antibodies are proteins that our body makes when we've been infected to fight off the infection. And we can actually measure those proteins or antibodies through a blood test. Those tests right now are really for public health officials to get a sense of how much infection has occurred in a population, or for researchers to study the COVID-19 pandemic. While we will have these tests available in hospitals and clinics, they are not a test for diagnosing infection at this time. To diagnose infection, we're going to use that swab test where we're looking for a piece of the virus. And finally, I just want to briefly touch on the stay-at-home, because I know this has been so difficult for all of us, and just look around the world and see where other places have relaxed their stay-at-homes and what's happened. And I think the best example for us is actually an island in Japan called Hokkaido. Hokkaido is an island of about 6 million people, and they were very aggressive, like California, at instituting stay-at-home, put it in place when they only had 66 cases, immediately brought their case numbers almost down to 0, and after about 3 weeks, they then relaxed their stay-at-home order. Well, what happened was about 3 weeks after they did that, they saw a rebound in their cases, so that at 1 month afterward, they were up to almost 300 cases, and then it went up very quickly to 500. So as long as this virus is transmitting anywhere in California or anywhere in the country, we are at risk. And so it will be important to stay in step with the rest of the state and ideally the country, so that we can all get through this together. And I will stop there, and Senator, looking forward to answering any questions.
Thank you so much, Dr. Brewer. And again, we are so grateful that you're with us each and every week, providing that overall perspective. And we're going to be getting to questions in just a few moments. Before we do, we'd like to be able to turn it over to the public health professionals who are joining us from Humboldt, Down Norte, and Trinity counties. We're going to kick off with the public health officer from Humboldt County. Dr. Frankovich will have 3, no more than 4 minutes to be able to provide an update. We'll give you a 30-second prompt. Dr. Frankovich, good evening. Thank you for your wonderful work. The floor is yours.
Hi, good evening, and thanks for this opportunity. Just to go over the things that you mentioned, we've currently tested over 2,000 residents here in Humboldt, and we've identified 54 cases of confirmed COVID infection. And I agree, it took a lot of sacrifice by the community and a lot of hard work by our public health contact investigation teams here to keep our case count under control during shelter in place. But we know that more expansive testing is needed, to really fully understand how much COVID we have in our community. And frankly, we haven't been able to test enough people to know that. So our big news is that the governor's testing task force, of course, as you mentioned, designated us as a priority testing site. And we were incredibly grateful and notified last week, and on Monday we became the first site operational. So we have worked this week. We're trying to get the process streamlined, as you can imagine, being first. There were some kinks to work out, and we've used this time frame to get some of our highest risk folks screened. So we're bringing in, healthcare workers, first responders, people who work in correctional and skilled nursing facilities and such, to get them in, and they've sort of functioned as our guinea pigs to go through the process. And we'll be doing more of this next week, and we are planning for this to be open and available testing access for the general public through an online registration system the following week. So it'll give us the ability to test up to about 132 people a day, 5 days a week, and with the possibility of expanding over time. The test results, they've told us, will be 48 to 72 hours. We have not gotten the first test results back yet. I would expect to see those on Thursday, but again, this is part of the process of being new. But we've been able to test already by the end of today. I think it was about somewhere around 230 people. So that's huge for us. And in terms of readiness and moving out of our shelter in place, we have been really working on those points on the governor's roadmap to make sure we put a masking order in place to help us be more safe as we move out of this. We have, as we mentioned, been working on testing. The possibility of being ready was a dream a week or two ago, and now it's really looking like a reality. Getting our contact tracing buffed up, our teams expanded, working on our alternate care site. The state provided us assets to do this, and our Emergency Operations Center folks have been really getting this thing set up with our partners. And again, we'll be working on the business and school readiness, helping everyone sort of reconfigure what their entity might look like to make it safe and have them able to open as soon as possible. So we're continually measuring our progress on all those indicators and assessing when we're ready to go. And we will absolutely be ready when the governor moves us into the next stage. And we were really happy to hear that it sounds like even in this stage 2, there will be flexibility on the local level, and that'll be really important for us to be able to do what makes sense for Humboldt. So we're really happy to see that.
Dr. Frankovich, thank you so much. That was Dr. Frankovich, Public Health Officer from Humboldt County. We are now going to turn it over to the Public Health Officer from Del Norte County. His name is Dr. Raywald. We're very grateful that you are on the line tonight, sir. You have 3 to 4 minutes. I'll give you a 30-second prompt. The floor is yours, and we appreciate all your work.
Thank you, Senator McGuire. It's a great opportunity to be with you again tonight, and looking forward to taking some questions. Our update is similar to Dr. Frankovich. We don't have a testing facility lined up yet, and it's great news for us because I'm hopeful that when they get things settled down and they're fully operational, if necessary, we might be able to send some Del Norte residents down that way. We have done about 350 tests from various offices, various sources. We've had 3 positive cases. Our 3rd one was this last weekend. We think all of them are basically community spread, community contact. We don't think any of them are related to travel. We've done a lot of contact tracing and investigation, trying to find the connection. We haven't found one yet. But we have to believe that represents that we have a low level of disease activity in the community. We're not a disease-free county anymore, haven't been for quite a while. I think the big news for testing to find out more cases for us is that we may get our own test site. We've heard some indicators from the state level that we might be a candidate coming down the road here in a few weeks. We're going to know more about that in about a week and a half, we believe. But locally at our hospital at Sutter Coast, they are now able to do some of their testing in-house. It's a limited test volume. They don't have a lot of test kits, but they're about ready to ramp that up probably by this weekend or next week. So for some cases that they need to know the answer right away, they may be able to get that turnaround time down to a very manageable level, maybe half a day or a whole day at the most, which is big news for us. Big news in any community where the testing turnaround time has been so hard to deal with. I've also heard that a similar testing system, not the exact same one, is likely to be used out at Pelican Bay State Prison. And that's still in the pipeline, from what I understand, but they're telling me that they're pretty confident that they're going to get some supplies to make it work pretty soon. And that's going to be big news for the prison and the inmates and the correctional officers, because obviously being able to test on site is a key thing for everybody. Still don't have any office tests of that nature. That I think that's probably the next step, but it hasn't arrived here. But we're getting better. I think the testing profile for small counties like ours is starting to finally turn a corner here and make some steps, and that's good news. And the other big news is, everyone's heard about the governor's discussion about reopening California, and we've been kind of planning for this for a while. I've been doing a weekly bulletin for residents in the county, kind of updating them on things, and on Monday I sent it out and included the idea of a reopening plan that we've been working on. And this week we've circulated that to Chamber of Commerce, the Economic Resiliency Team, a few other key people, including the Board of Supervisors. So everyone's going to look at that this week, and we're going to get some feedback, and hopefully we'll be able to be ready when the state of California is ready. So we're looking forward to a couple of weeks of working on this and helping people get prepared, and then we're ready to go.
Thank you. Thank you so much, Dr. Raywald. We are so grateful. Questions, comments for Dr. Raywald, Dr. Frankovich, Send them in right now, senator.mcguire@senate.ca.gov. Before we go to your questions or comments tonight, we would like to be able to turn it over to the Trinity County Director of Public Health Nursing. That's Marcy Kutzall. We also have the County Administrator for Trinity County, Richard Coons, on the line. They'll be talking about the current confirmed number of cases in the county, a testing update. They'll also talk about what the opening up of the community will look like, the potential timeline. Ms. Kutzall, the floor is yours.
Thank you, Senator McGuire. To date, 83 tests have been conducted in Trinity County. All of those have been negative. This testing number represents roughly 0.6% of our population and is woefully insufficient in providing the metric needed to guide local decision-making. With that said, we are reaching up the chain to engage state partners around the need for a high-throughput Optum testing site in Weaverville. Weaverville is the county seat, and for the majority of our communities, Weaverville falls within that 60-minute travel threshold that the governor has established for access in rural testing deserts. Otherwise, without that, the majority of our communities would have to travel approximately 2 to 3 hours to access a testing site in either direction, west or east. East or west on the coastline, Humboldt, for example, or east Shasta. We know, because we know that broadening testing and isolating positive individuals and contact tracing of exposed individuals is absolutely foundational to decision making around the safe modification of our the modification of those orders put in place by the governor and our health officer. We have begun to engage partners through our multi-agency collaboration work group. That continues. We share information and we guide our response collectively. We are specifically recently engaging our forestry service and our healthcare providers around what it looks like in the near future with, for example, forestry workers coming in, firefighters coming in from all over the state, and there'll be a number of those individuals coming in, not just firefighters, but support staff with the forestry service. We've been in discussions with each of those chiefs, and we're looking at particularly how to address the issue of quarantining them in cohorts and how to manage that for 14 days in a limited housing, with limited housing for those individuals. They would indeed have to share a bathroom and a kitchen. And so for that reason as well, testing becomes particularly important when we look at essential workers and the ability to rapidly test essential workers and get those results back. We're talking about high numbers. But with those, with the high throughput labs being able to test 132 tests a day, that would easily cover the fire personnel in 1 or 2 days. And so the good news is we did hear word today that Shasta County has their high throughput Optum test site stood up. It wasn't clear to me in the email if it was beginning today or May 1st, but they are taking calls, but they're only testing at this time healthcare workers. So we are thankful for that we can get our healthcare workers tested, because one of the things we're looking at is working with our healthcare provider partners to get back to doing some preventative care, especially for children. This is really important with children being out of school, getting them in for their well child checks, their vaccinations, and making that happen prior to the beginning of the school year.
And Ms. Kutzall, we have about 30 seconds.
Okay, thank you. And so we are working with them to, and we're looking at metrics that can move us toward that, such as, rates in surrounding counties, have those leveled out over 14 days and that sort of thing. So thank you so much. That's it.
Director Kutzall, thank you very much. We're going to be going to the County Administrator, Richard Coons, here in just a bit to talk to us about what opening up may look like in Trinity County. We'll go to him in just a few moments. We'd like to be able to get your questions and comments. We're now at about 275 questions and comments that have come in from the town hall. We're still holding at about 870 folks. Thank you so much for joining us tonight. Let's get your questions. The first question is going to be for Dr. Brewer. Dr. Brewer from UCLA Medicine. This one is coming in from Mitch in Crescent City. There's been a lot of discussion about the virus shrinking in the summer heat. True or false? Dr. Brewer.
So, Mitch, you are correct that, in general, respiratory viruses do not spread as well in high temperatures and high humidities as in cold temperatures and low humidities. But I have no reason to believe that we'll see any significant change in virus transmission with COVID-19 over the summer, and that's why the stay-at-home orders and the other public health measures are so important to maintain.
Thank you so much, Dr. Brewer. We're going to stick with you. This next question is coming in from Georgina in Eureka. How long will it be until we see a vaccine? One more time, how long will it be until we see a vaccine? Thank you, Georgina in Eureka.
Well, Georgina, there's actually a vaccine that's already being in what's called phase 1, phase 2, which is the first part of a clinical trial to understand if a vaccine is safe in humans. But as Senator McGuire, said, I don't expect us to really have a vaccine for another year to 18 months.
So does that mean, Dr. Brewer, would it be accurate that all said and done, as far as being widely available, we're not looking until early to mid-2021 to be widely available to the American public? Is that accurate, do you believe?
That is correct. So the tests that are going on right now, even though they are tests in humans, these are just the very earliest tests to make sure, are the vaccines safe? And then we have to test and find out, do they actually work? So we have a long way to go yet.
Thank you so much. We're very grateful, Dr. Brewer. We're now going to turn it over to Dr. Frankovich from Humboldt County. She's the public health officer. This question is coming in from Pam, Dr. Frankovich. If county IHS workers and hospice workers, she's asking, can county IHS workers and hospice workers be included in the first wave of healthcare workers mentioned that may be able to be tested? Dr. Frankovich?
Yes, well, that's a really good question. We are looking to include those folks in DHHS workers. We're looking at those individuals who have a lot of higher risk contact, for instance, individuals who are going into homes, that type of thing. So, yes, we do want to include folks who have some of those higher risks, and we're just building those lists right now. And again, then ongoing, other individuals, we're looking at, our grocery store cashiers, are a lot of the people who support some of the infrastructure right now who have a lot of frontline exposure. So we're trying to pull in as many people as we can, but we'll also have ongoing capacity even once we open up generally to the public to be able to get some of these higher risk groups in as well.
Thank you so much, Dr. Frankovich. We're going to stick with you. This next one is coming in from Patty in McKinleyville. How long will the testing be available through the state? Let's go to Dr. Frankovich.
Sure. Well, they've told us that they're evaluating every month about our usage, so we're definitely keeping things busy. But this is expected to be an ongoing resource for us in the community. We don't have an end date.
Thank you so much. We are now going to Del Norte County and Dr. Raywald, the public health officer. This is coming in from Miss Adams. She is a local realtor and an Airbnb host. Dr. Raywald, she's saying, can you offer any forecasts when in Del Norte County we may be able to open up again for short-term rentals? I think that depends on the state. But Dr. Raywald, you're the expert. We'll turn it over to you.
Yeah, I think you already answered it. It really does depend on the state to some extent. But I sort of consider the short-term rental market, especially the vacation rentals, to be something that's critical for the county once we're given the green light, because our counties up in this part of California, we all survive by tourism dollars, and the trick is to make sure we don't overstep and open too much too fast, and there is a risk to that. But yeah, I mean, we've been thinking about that a lot, and I think once the state gives us the green light and gives us some steps to take, I think we'll be moving in that direction.
Thank you so much, Dr. Raywald. He is the public health officer in Del Norte County. We're going to talk to Dr. Brewer from UCLA Medicine. Then we're going to come back to Dr. Raywald on this next issue. This was turned in by Donna in Crescent City. I'm going to give you her comments, and then I'm going to send a question over to Dr. Brewer and Dr. Raywald. First, Donna's comments. She says the stay-home cure for the virus is fast becoming worse than the disease. Depression and suicide for those who are alone. And here's what she says. There is no cure for SARS, H1N1, Ebola, AIDS, and countless flu variants. So let's talk about that. Donna has some concerns. Dr. Brewer, what is the difference between the coronavirus, H1N1, Ebola, other flu variants, and why does this have to be treated differently? We'll start with Dr. Brewer from UCLA, then we're going to go to Dr. Raywald from Del Norte County. Dr. Brewer.
So, Donna, it's a terrific question. So let's take Ebola and and HIV/AIDS and put them aside because they're actually spread by bodily fluids. So you actually have to come in contact with someone's blood or saliva in order to catch them. So they're not respiratory viruses. So let's set them aside. Influenza. So our last pandemic, influenza, H1N1 2009, estimated between April of 2009 and April of 2010, 60 million Americans, about 20% of the population, got infected with that virus. 12,000 died. That's a mortality rate of 0.02%. The mortality rate from COVID-19 right now in California is running at 4%. That is 200 times higher than the H1N1 mortality rate. Imagine what would happen if 60 million Americans came down with COVID-19. So we would be talking about 2 to 3 million deaths in a very short time span, and that's why we need to take this virus so seriously.
Thank you so much, Dr. Brewer. Dr. Brewer from UCLA Medicine. We're now going to go to the public health officer for Del Norte County, Dr. Raywald. We're looking for your questions, your comments related to Donna's question.
Yeah, I would add to what Dr. Brewer said by reminding people that there's two key things about this particular virus. One is that it's a novel virus. It's new to humans, which means that in theory everybody is susceptible. So there is no real upper limit of how many people in the country get infected unless we reach the point where there's enough people infected that it starts to slow down transmission. That's what people call herd immunity. And I think most of the experts think that won't even happen until we get 60 or maybe even 70% of the population infected. And then the second thing about it is that it really targets older folks. It targets people with complicated health conditions. There are a lot of exceptional cases in younger categories that we hear about on the news a lot, but in the main, the fatalities are people in advanced middle age or the elderly. And, we're doing everything we're doing to protect them, and that really is kind of a mission for everybody to consider, because everybody has grandparents or parents or have close friends who are grandparents or parents, and we're really trying to protect that group of people the most because they're the ones at the highest risk.
Thank you so much, Dr. Raywald. We're now going to go back down to Humboldt County. Dr. Frankovich, we have two questions for you, one from Johnny in northern Humboldt and then one from Sherman in Eureka. Let's go to Johnny's question first. Dr. Frankovich, he says, we are not in a closed system. Many people travel to our region to recreate. In late summer, we see a huge influx of seasonal cannabis trimmers to our region from all over the world. What plans, if any, do we have on restricting travel to our region for tourism or for cannabis work? Dr. Frankovich?
It's a really good question. We have a couple things I would mention with that. The governor in his announcement really, I do think, highlighted that issue of travel, and that really opening up travel would be something later as we move forward rather than one of the first steps, for the reason that you mentioned, is that travel can bring people from higher density areas of cases to lower and change the community picture really rapidly. And we saw that actually happen in Humboldt when we had several groups of travelers who brought our case count up really quickly and took a lot of work to contain spread from those cases. In terms of the growers, the cannabis workers, we have put out messaging to really ask growers to preferentially hire people from within the area to increase safety. We've also emphasized the need to quarantine new workers coming into the area for 14 days to decrease transmission, and of course to emphasize that everyone coming into our community currently needs to abide by the shelter-in-place orders that are present both on the local and state level. But it is a concern for all of us, and I think speaks to the issue of needing to have the entire state ready as we really are opening up, because we're interrelated. Travel happens here even when we may not intend it to.
Thank you so much, Dr. Frankovich. We're going to stick with you. This next question is coming in from Sherman. Sherman is in Eureka this evening. Here's his comment and question. Humboldt County has tested close to 2,200 individuals for the coronavirus, with 54 cases found. What is the probability of a false negative for the test used, and what does that convert to possible missed individuals? Dr. Frankovich, if you can give that answer to Sherman, please.
Sure. Basically for us, even though we've tested 2,000 people, it's, I think, about 1.5% of our population. So it's a much lower number than we would like to see. In terms of false negatives for this, the one thing I would tell you is that the Humboldt County Public Lab has been doing a lot of these specimens, as well as the commercial lab, and they're using a very highly sensitive and specific test. Doesn't mean it won't get everything, but when we look at, for instance, our positives, we have I think it's a 99-something% sensitivity on being able to pick up those infections. So it's a really highly accurate test, particularly when you compare it to some of the more quick point-of-care tests that are coming into use. So I actually have very good confidence in our testing, positives and negatives in our area. But you are right that certainly when we're in times of low prevalence within the community, some of those things can be off a bit.
Thank you so much, Dr. Frankovich. We're now going to be going to Trinity County, to the Director of Public Health Nursing. That's Marcy Kutzel. Marcy, Mary writes in saying that she has heard that the virus won't peak until fall in Trinity County. Can you say, is that true or false? Director Kutzel.
That's a really good question, and I don't know. I honestly do not know that. I would love to hear from Dr. Brewer on this, if he has any insights on specific counties and when this illness will peak. I can tell you that without broad testing, it's really difficult to make that prediction. And I don't know, going back to what Dr. Brewer said, that the virus may potentially continue to be infectious throughout the summer. At any time, I know that the pandemic flu precedent that was set in 1918 really demonstrates that when you relax these orders, the stay-at-home orders, the isolation orders too soon, the rebound can be just as bad. And so I think it depends moving forward how we behave as a county and how broad we can test and what we can put in place to ensure that doesn't happen.
Thank you so much, Director Kutzel. Let's go to Dr. Brewer. Then we're going to go to Dr. Frankovich and Dr. Raywald as well. Dr. Brewer is from UCLA Medicine. Dr. Brewer, a lot of Northern California counties are saying that a peak of the virus won't hit until the fall. Is that because we've been sheltering at home and essentially flattening the curve, spreading it out? Dr. Brewer, what say you?
So, yes, Senator, we have been flattening the curve and we have been pushing it out. but what that's allowed us to do is keep our health system from being overwhelmed, as occurred in New York City and northern Italy. So while it is prolonging the peak out, it is actually been incredibly valuable for helping us to save lives and maintain our ability to treat people in the hospital.
Thank you so much, Dr. Brewer. Let's go to Dr. Frankovich in Humboldt. Dr. Frankovich, when do you expect the surge in Humboldt, or the peak, if you will? Are you expecting it in fall? And we'll go to Dr. Raywald in Del Norte with the same question. Dr. Frankovich?
Well, what I would tell you is that, the models that we use for this have increasing unreliability when you're early on in terms of number of cases. So there's a whole lot of suppositions we have to make. However, what I would tell you is that when we constructed this and looked at if we had nothing in place, absolutely none of these shelter-in-place or other provisions, we had estimated a peak that would have been in July for Humboldt County with, pretty massive hospitalizations that would overwhelm our system. With all of the current shelter-in-place measures, we would project that this would actually be more like November or December, and obviously a much lower number of cases that would be far more manageable. So we know that as we begin to ease these restrictions, we're going to be somewhere in between those two things. And the big question is where and how high a peak.
So it would be fair to say in Humboldt County, peak is expected somewhere around late summer, early fall. Is that right, Dr. Frankovich?
Yeah, I would say if as we go forward, it certainly would be we would expect it to be after the July area, July to August, and pushing into fall. But again, a lot of that will depend on, as we move out of the shelter in place, what happens on the ground.
Thank you so much. That's Dr. Frankovich. She is the public health officer in Humboldt County. We're now going to go to Dr. Raywald. He's the public health officer in Del Norte County. Dr. Raywald, same question. When do you expect the peak in Del Norte County?
Well, I'm hopeful we don't really experience a peak, not like we've seen elsewhere. And I think the take-home for a lot of people is that we implemented these measures before we even knew we had our first case. So we have seen almost no activity. It's hard to measure a peak when you've had 3 cases spanning about a month. I would agree with Dr. Frankovich that if everything is left the way we are now, our peak would probably mirror theirs, and it would probably show up in the fall. But as we take things away, we expect more disease transmission to start to happen because there's more opportunity from person to person for the virus to propagate, and then we'll have more cases that we know. So I think it does change the dynamic almost week to week, depending on what we relax and how we go about it. And that's the real take-home message, is that we have to be very, very careful because we really have one chance to get this right. And if it goes badly, we have to come back to where we are now, and we will not really have gained much except maybe a little bit of painful experience. So I think people need to be kind of guarded in their optimism about how it progresses, but very guarded, because it could be a complicated piece of reopening that really has implications for a lot of people.
Thank you so much. We're grateful, Dr. Raywald. We're going to stick with you. We have our next question in from Robert in Crescent City. What's going to happen with our county fair this year?
I suspect, from what I've heard and what I know, that it will not take place. And I think that's because we can't guarantee that we will have the relaxation of the gathering requirements that are currently in place by August. It's kind of in that gray zone area of timing. But as you pointed out at the very beginning, Senator, a lot of the events that we look forward to in the summer, they just aren't going to happen in the middle of this pandemic. And I think it's probably not going to take place. If it does, it's going to be a very modified picture.
Thank you.
And that's really my answer.
I appreciate that, Dr. Raywald. We're now going to be going to Dr. Brewer from UCLA Medicine. Dr. Brewer, we have a couple of questions from you. A lot of questions about masks tonight. Dr. Brewer, folks want to know, are masks really going to prevent individuals from spreading the disease? Spreading the virus. Number 2, can you answer Mike's question? Mike writes in from Arcata. could a used mask or filter be rendered reasonably safe to reuse without washing it after it's been quarantined for a number of hours? Couple questions, one from Mike, the other is a theme that we're seeing tonight. How do those masks really stop the spread of the virus? Dr. Brewer, two questions.
So Mike and Senator McGuire, the role of the mask is to catch respiratory droplets that come out of our mouth. So one of the things that we've learned is people who are asymptomatic, feeling fine, can be infected with COVID-19 and can spread it to other people. And when we talk or when we cough or sneeze, we produce little droplets of mucus and spit and virus that if they land on someone else or on a surface that someone else touches, they could become infected. So the goal of the mask is to catch those droplets and keep them from getting out to where they might infect other people. Viruses do not survive for long periods of time outside of cells. They need to be inside of cells to survive. So if you took your mask and you stuck it in a paper bag, for example, and left it alone for 7 days, then there would be no virus left alive on that mask.
Thank you so much, Dr. Brewer. Dr. Brewer, we have another question, this time from Diane in Redway in southern Humboldt. She wants to know, this is a related question in regards to how long that virus can stay on a hard surface. She wants to know if she can contract the coronavirus from her phone. Dr. Brewer.
So viruses tend to survive in the order of minutes to hours on hard surfaces. In laboratory conditions, we can get them to survive up to days, and the longest so far for COVID-19 has been 7 days. But in general, it's minutes to hours. If you wipe your phone down with soap and water or a disinfectant, then that should eliminate any virus there. But the important thing to do is after touching phones or other surfaces that may be contaminated is to wash your hands. That's really the way to protect yourself from getting viruses that may be on surfaces.
Thank you so much, Dr. Brewer. We're going to go back to Dr. Frankovich. Dr. Frankovich, we love the Humboldt crabs on the North Coast. And this question is coming in from Alan in Eureka. Is there anyone at the county level planning guidelines for baseball? This is what Alan writes. Or in other words, what will drive the decision to have the Humboldt crabs play this summer? Dr. Frankovich, I know you're a big Crabs fan. We love it. We go a couple of times every year. They have the best band ever. But tell us, what's in store for the Humboldt Crabs this summer?
I know. My husband and I were so looking forward to these games. So it's hard, isn't it? What I would say is that at this point, the issue really is two things. One is assembly of people, right? And so I think that when we begin opening up, we're going to be talking about small groups of people gathering and then gradually increasing those sizes as we go, just as the way we went into this, right? We started with getting rid of mass events, going down to 200 and then 50 and then 10. And so I see us kind of moving in that reverse order. I think in terms of trying to have games where you actually have a big spectator crowd, I think that's going to be challenging early. But again, as we start to open things up over the course of, the summer, who knows? With social distancing in crowds, with all those kinds of things, maybe that will become possible. But I think it's really hard to project right now where we're going to be in each month of the summer.
Thank you so much, Dr. Frankovich. We are taking your questions, your comments tonight for our town hall. If you have questions or comments for the public health officers of Del Norte, as well as Humboldt County, email us, senator.mcguire@senate.ca.gov. We also have the Director of Public Health Nursing from Trinity County on the line, and Dr. Brewer, an infectious disease physician from UCLA. We look forward to hearing from you. We're going to stick with Dr. Frankovich from Humboldt County. This one is coming in from Breyer, who is with Lost Coast Brewery. Dr. Frankovich, I'm going to paraphrase the question. Long story short, Breyer travels for business for meetings with outside sales. Deals a lot with wholesalers and major retailer chains. Recognizing that international and cross-continent travel will be compromised this year, I plan to focus most of my travel inside California. What protocols and mitigating objectives should I be considering when traveling to such California metro regions, and how should I conduct myself upon my return to Humboldt? That's coming in from Breyer from Lost Coast Brewery, some of the best beer on the planet. Dr. Frankovich.
Well, I think you've probably during this period been doing a lot of your work remotely, virtually, which is, what we've been trying to do as much as possible for work settings that will allow that. I think the question really is two things. One is for essential businesses, what are we doing? And certainly at this point, travel has been allowed for essential travel, but not for non-essential and recreational travel. How that unwinds over the coming months is not clear, but again, I think more the travel that is recreational and non-essential will certainly be a later piece. I would say just in terms of safety for anyone who actually does have to travel, that all of those measures we've talked about are really important. That all of the social distancing, the frequent hand washing, I'd certainly recommend masking throughout in public settings, as well as, the monitoring yourself for symptoms and frequently cleaning surfaces that you are in control of are all really helpful measures. But again, I think the big thing is trying to avoid settings where there are congregate groups of people, because each of those instances increases risk.
Thank you so much, Dr. Frankovich. We're now going to go to Marcy Kutzel. She's the Director of Public Health Nursing in Weaverville. We'll also be talking to Dr. Brewer on this question. This next question is coming in from Veronica in Weaverville. Veronica says the CDC says that the virus can't survive in public swimming pools, maintained well with appropriate chemicals. Will public pools be allowed to open this summer in Trinity County? Let's go to Marcy Kutzel. She's the Director of Public Health Nursing. And then we're going to go to Dr. Brewer to be able to talk to us about the safety of swimming pools in this era of the coronavirus. Let's first start with Director Kutzel.
Thank you for that question, Veronica. We're really looking at risk-benefit and really looking at safety. And as we work with the governor's office in loosening up some of these modification of orders, we're going to take each individual scenario and kind of look at that. I think I would love to hear from Dr. Brewer as an infectious disease expert on his take on survival of the virus in a swimming pool.
Thank you so much, Director Kutzel. Let's go to Dr. Brewer. So, look, one of the best things you can do over summer is go into the pool. Let's talk about that, Dr. Brewer. How safe is it to be able to go into the pool? I think one of the other challenges, too, is going to a public pool and avoiding crowds as well. So, Dr. Brewer, UCLA Medicine, the floor is yours.
So you're exactly right, Senator. So it's very safe to go into your own pool in your own backyard if you're maintaining it appropriately with the right chlorine levels. The chlorine will kill the virus, Veronica. But the real risk in going to a public pool is not the water in the pool, it's all the other people who are at the pool as well, because particularly if you're swimming in the swimming pool with other people, then those masks are not going to be effective, right? They're all going to get soggy, wet. You're going to take them off. So the risk is not from the water if the chlorine levels are maintained. The risk is from coming into contact with other people while you're all at the swimming pool.
Thank you so much. So again, Dr. Brewer, that chlorine will kill the virus, you say, correct?
Correct. So if it's maintained at an appropriate level, the chlorine will kill the virus, but it will not protect you from all the other people in the pool who may be around you talking, coughing, or sneezing.
All right. We're going to stick with Dr. Brewer, and then we have a lot of questions coming in tonight about Why can't we open rural counties with a regional approach? I promise you in just a few moments we're going to be talking about that. We'll be talking about that regional approach, how that may look in just a few moments. But we have another question coming in for Dr. Brewer from David. It's a two-part question. Number one, Dr. Brewer, is the coronavirus on the East Coast more severe because it came from Europe and not as severe on the West Coast because it came from China? I realize the virus originated in Wuhan. Second question, is there a connection between the coronavirus and stroke among younger adults? Two parts, Dr. Brewer, one answer.
So, David, in answer to your first part, it's basically all the same virus. So while RNA viruses do mutate or change as they spread, we have not seen any significant changes in this virus anywhere that it's found in the world to change either how easily it spreads or how deadly it might be. So you can think of it all just as the same virus. This virus does seem to interfere with the blood clotting system in the body, particularly among individuals who are very sick, not people who have mild disease, but who have very serious disease. And we have seen cases of strokes or clots in the lungs called pulmonary emboli in people of all ages who have very severe disease with COVID-19. But we do not see that in people with mild or moderate disease.
Thank you so much, Dr. Brewer. We have a few moments left. We want to make sure that you get your last-minute questions and comments in. Senator.McGuire@senate.ca.gov. One of the most popular questions tonight was focused on, will the state allow a regional approach in rural counties to be able to open up? And some examples that folks have been sending in, Del Norte County has 3 positive cases. In Trinity County, no one has been tested positive. But as we've heard from the director, enhanced testing is needed. So here's the answer, and we'll turn it over to the public health officials to comment on this. And I always want to be honest. We're still a few weeks away, being candid, a few weeks away from any decision by the state to open up rural counties. I promise you that the approach is being considered, and any decision would be in coordination with local public health officers, whether it's Trinity or Del Norte or Humboldt County. Here's the concern that the state has. We're entering the tourist season. Folks who will be traveling will eat out, and potentially an individual who is positive would go to the chart room in Crescent City. That individual who is positive, who potentially came up from the Bay Area, would then infect a local resident. What we know is this virus is going to be with us for at least another year to year and a half. So to be able to open up on a regional approach, here is what the state needs to see from each county. Adequate hospital bed capacity to be able to handle a potential surge. We need to be able to make testing more robust, which is why you're going to see these additional 80 sites rolled out, especially in rural counties. We need to see rural counties advance what that modification and safety plan will look like to be able to open up small retail or expand restaurants. We need to make sure that there's sufficient protective gear in the county and that contact tracing is implemented by the counties with assistance by the state. So again, I never want to be able to deliver bad news, but I also want to be honest. We're a couple to 3 weeks away from any type of decision, minimum on that. We're not months away, a couple or 3 weeks, but I wanted to open it up to the public health officers first with Dr. Raywald in Del Norte County. Feel free to push back on me, Doctor, if you think I'm mistaken on that. Dr. Raywald.
No, I think you nailed it. It's all those components really have to be in place. And, you know, we're so close, I think, in 2 or 3 weeks that, you know, when the time comes for the state to make a decision, we're all going to be in a much better place. We'll be ready or nearly ready with all those parameters, especially testing capacity, contact tracing capacity. And here's the thing, you know, use the example about the chart room. if everything is in place in the proper way, then maybe that person traveling up from the Bay Area isn't going to infect anybody at the chart room because the servers are wearing masks and they've spaced out their tables and they have it ventilated properly so that the virus doesn't transmit around. We have to really drill down and get all those components of all the businesses that might, affect tourism, for example. They all have to be kind of working together to make sure that the transmission is not going to take place.
Thank you so much. Dr. Frankovich, any other items that you want to be able to quickly add to that? We have a few more questions. We're running out of time, but Dr. Frankovich, quickly.
No, I echo that, and I think that we need to be ready in all the ways that you mentioned locally. And I'm encouraged by the fact that the governor has indicated that right in the next stage we're going to have some ability to customize on the local level, and I think that's huge. To see what makes sense for our particular areas. So I'm looking forward to that opportunity.
Thank you so much. Let's go to Director Kutzel quickly in Trinity County.
Spot on, Senator McGuire. This is the recipe for safely modifying those orders.
Thank you so much, Ms. Kutzel. We're going to go back to Dr. Frankovich. This one is coming in from Mary. Mary, who owns Sheer Designs Hair and Nail Salon. Dr. Frankovich, she has a couple of questions. I'm going to get down to two of them. She has more, but I want to be able to get, I think, to the two most important. When will we be advised of a plan, guidelines, or giving guidance for salons? And Mary wants to know, how are we going to proceed with a 6-foot social distancing statute? So, Dr. Frankovich, look, a lot of folks have not had haircuts, haven't been to the salon, almost going on 2 months now. So can you talk about some of those guidances that we can give salon owners on what this may look like?
Sure, and I'm with you on that. I'd love to have the ability to get my hair cut. So I do want to just point out that you're right. There's not a possibility of completely social distancing in that setting because you have to have that contact between the person working on your hair and the client. And so what the governor has emphasized, and I think our planning is looking at, is, initially opening everything that we can that allows social distancing from start to finish of the encounter, and then bringing on board some of those businesses, such as salons, that can't do that the entire time, but can put a lot of safeguards in place, so where you still can't get rid of that person-to-person, one-on-one, but you can space people out in the salon, you can do all the cleaning, you can do masking of the person doing the hair cutting, so all those things will help move that along. And that's how we would envision it, but we welcome your input, and I know a survey is going out, and we're asking for your types of businesses, all businesses, to think about and give us ideas on how you can operate safely.
Thank you so much. We are going to go to final questions, ladies and gentlemen, and thank you for hanging with us. We started out with over 800 folks. We're now at about 740 still with us tonight in Trinity, Del Norte, and Humboldt counties. We're going to go to our final two questions for Dr. Brewer. Then we're going to go to Dr. Raywald in Del Norte. All right, Dr. Brewer, you have a comment about a mask. This one is coming in from Ellen. Ellen says a mask is not healthy. Breathing your own toxic exhaled carbon dioxide can be quite harmful. Break it down for us. Is a mask better for someone's health, or is Ellen correct that a mask simply is not healthy? Dr. Brewer, UCLA Medicine.
So, Ellen, we don't actually recommend masks for people who have trouble breathing at all, so we certainly wouldn't want to do anything that would obstruct an ability of somebody to breathe. However, for the majority of us who do not have trouble breathing, the point of the mask is really just to catch those droplets that come out of our mouths as we breathe, talk, and speak. And carbon dioxide will not build up behind that mask to any sufficient level to cause any problems for someone who is otherwise healthy and has no trouble breathing.
Thank you so much. Last two for Dr. Brewer. And Dr. Brewer, every time we get questions about cats, we have 5 questions tonight about cats. Talk to us. Folks continue to be worried that they can get this virus from their cats. There were 2 confirmed cases last week on the East Coast. Set the record straight, Dr. Brewer.
So cats, yes, do seem to be able to get COVID-19. However, there is no evidence that a cat or any other animal right now has spread COVID-19 directly to a person in the United States. So as far as we know, it's all human-to-human transmission. If you keep your cat indoors, stay at home for the cat, just like stay at home for the person, then the cat will not be exposed. No way that the cat can catch the virus.
Thank you so much, Dr. Brewer. And the final question for Dr. Brewer is this. It's coming in from Rebecca. She and her husband are the caretakers for Rebecca's elderly parents. She wants to know, should we continue to shelter in place even after shelter-in-place requirements are lifted? She's worried, since they are caregivers, that they will expose her elderly parents to anything out in the public. So talk to us about this, Dr. Brewer. There are millions of folks across California, tens of thousands on the North Coast that are still going to be vulnerable even as we relax these shelter-at-home orders. What is your advice to them and how they should proceed in our community?
So, Rebecca, terrific question, and I suspect when the governor and the public health officials on this call think about relaxing those orders, they're probably not going to relax them for our most vulnerable populations first. So as you go out and engage more in society, things that you can do to protect your parents include wearing a mask while you're in public. Make sure that as soon as you come home, you wash your hands. Make sure you're washing your hands when you're involved with any food preparation or engaging in any cleaning of your parents or cleaning of their room. Keep your surfaces clean, so wash them soap and water. Use disinfectant as appropriately indicated on the labels. And if you get any symptoms, if you get a fever, you get a cough, sore throat, try to see if someone else can take care of your parents until you know that you're better and no longer potentially at risk for transmitting infection to them.
Dr. Brewer, thank you so much. We love it when you're with us, and we so appreciate your hard work. Dr. Brewer also was making the rounds in the hospital earlier today, so we appreciate you being with us tonight. Let's turn it over for our final question to Dr. Raywald. Dr. Raywald, this is coming in from John in Del Norte County. How many of the 3 hospitalized are now back in the general public? Dr. Raywald.
All of them, actually. They were all convalescing at home. 2 of them we considered recovered just because of the duration of time since the onset of their symptoms. There's different ways of determining if someone is recovered, and one of them is called the no-test strategy, and we basically used that for those 2. And the 3rd case is still convalescing, but they all managed this at home.
Thank you so much, Dr. Raywald. We're grateful. We're going to go to the final question to Dr. Frankovich, and this one is coming in from Noel in McKinleyville. I'm going to paraphrase. It's a little longer, Dr. Frankovich, but Noel is saying that we're about to go into tourist season, and he's concerned about a few things. First of all, the influx of new people into our community over the next 4 months. What do you think that is going to mean for the county? What about those large tourist buses that come in to look at the Redwoods and Redwood National Park? And are you concerned about the community safety with those folks coming into the community, over 1 million strong, visiting Redwood State and National Park? Dr. Frankovich, the floor is yours.
Well, thank you. Yes, I mean, travel is always a concern for us. And at this point, again, under the current orders, travel is for essential purposes only. So it really should take that type of travel off the plate until we're at a point in reopening that allows it. And so, again, at this point, we should be in essential travel only. That being said, we know there is always going to be some movement between counties. We are unable to shut down a highway. We need our airports. And so I think it is really a reason for using caution as we go forward and keeping all of those other measures in place that we have already put in terms of social distancing, masking, all of that, even as we lift some of the restrictions of shelter in place.
Dr. Frankovich, thank you so much. We want to say thank you to Dr. Brewer, UCLA Medicine, Dr. Raywald, Public Health Officer for Del Norte County, Director Kutzel, she's the Director of Public Health Nursing in Trinity County. We want to say thank you to Dr. Frankovich, Public Health Officer in Humboldt County. Look, all 4 of these individuals have been on the front lines combating this virus. It's been a hell of almost 2 months for everyone on the line tonight, and it's been a hell of a 2 months for those who have been trying to keep us safe. We want to say thank you to our esteemed guests tonight for the town hall. Our goal for tonight's town hall was to be able to give you the most accurate information possible from those who are on the front lines. Would like to be able to bottom line a couple issues, and then we're going to wrap up this evening. Again, the state is focused on establishing the process to gradually reopen lower-risk workplaces. We want to be able to get folks back to work. We want to be able to reopen our economy, but we have to learn from mistakes across this planet. We have to learn from other countries that opened the doors too soon. They swung open the doors. Here in California, we want to do it safely and strategically. You can expect statewide modifications to be done in stages over the next several weeks, not months, as long as we continue to keep virus numbers low. A recording of tonight's town hall will be available via our website. You can email us at senator.mcguire@senate.ca.gov for a full recording. We'll send you that audio recording. The audio recording will be completed by Thursday, April 30th in the afternoon. Again, thank you all for joining us. We are truly appreciative of your sacrifices. We know so many are hurting, which is why we want to be able to balance the need of public health while also getting folks back to work. We hope all of you stay healthy and stay strong, North Coast. This has been your North Coast Coronavirus Town Hall. We are now concluded. Thank you so much for joining us.